So today's topic is HPV and oral cancer. So a few questions. Have you ever noticed that your hygienist is the health practitioner that you see most often? Have you ever discussed the link between HPV and oral cancer with your dental hygienist? You are supposed to receive a comprehensive screening as a part of your care. Do you know if you do? Has your hygienist reviewed and demonstrated a self-detection screening before? Have you ever done a self-screening before on yourself? Oral cancer is transmitted between partners through oral sex and intercourse, and normally linked to the target population ages 15 to 24, which makes up 75% of new cases, and 25% of oral cancer occurs in non-smokers who don't have any other significant risk factors.
So what to look for? You want to be looking for a red or white patch in the mouth, a lump or thickening of the tissue in the mouth, neck, or face, sore in the mouth, including under the denture or an appliance, which bleeds easily or does not heal within 14 days, numbness in the mouth or the face, persistent earache in only one ear, continuous sore throat or persistent infection that lasts for a long time or recurs, hoarseness or change in speech, pain or difficulty swallowing, speaking, chewing, or moving of the jaw or tongue, wart-like masses inside of the mouth, a lump in the throat, or feeling that something is caught in the throat. But good news, there are a number of ways to reduce your risk. Here are a few suggestions. Eliminate use of tobacco products and avoid excessive alcohol consumption. Avoid combining tobacco and alcohol use. Eat a well-balanced diet. Avoid unprotected exposure to the sun. Practice safe sex and limit number of sexual partners to reduce risk of HPV infections. Consider the HPV vaccination ideally before becoming sexually active. Have regular dental hygiene visits including oral cancer screenings, and perform regular oral self-examinations. 5 easy steps to good oral health. It takes just a few minutes a day to help ensure good oral health. Here are 5 things that you can do to enjoy healthy gums and teeth. Brush your teeth daily, floss your teeth daily, rinse using an antiseptic mouthwash like Listerine, make healthy food choices, and get regular dental hygiene care.
Today we will be doing a tutorial on how to do an at-home evaluation of an oral cancer screening. Your first step is to wash your hands. Examine your face and neck, looking at the skin on your face along your hairline, looking for molds, growths, sores, or any changes in color or the size of an existing mole. Check for growths or change in your skin texture, swelling or lumps that occur only on one side of your face or neck. Check under your chin as well. Lift up your upper lip, examining your gums, the inside of your lip for any color changes or sores. Then feel along your upper lip for lumps or changes in your tissue texture. Repeat the same for your lower lip. Examine the inside of your cheeks for red or white patches. Check the tissues for swelling, hardness, or tenderness. Lift your tongue so that it touches the roof of your mouth so that you can examine the floor of your mouth and the underside of your tongue. Feel for any swellings or hardness and look for color changes or texture changes. Stick your tongue straight out, moving it side to side, and note any limitation in movements. Examine the surface as far back as you can see for any swelling or color changes. Then feel the sides of your tongue for lumps or hard spots, any changes in color or texture. Open your mouth as wide as you possibly can to see any color or texture change on the roof of your mouth. Check for lumps or swellings. Lastly, say ah and examine your throat for signs of texture or color change. This may appear quite red simply due to allergies or mouth breathing, but pay attention to persistent or recurrent throat infections. Lastly, you can wash your hands. And to note, if you do find something that does not appear normal or doesn't have a known cause and it does not heal in 14 days, visit your dental hygienist for an oral cancer screening.
So we hope that you have taken something away from this video. If you haven't had the discussion with your hygienist, please do. Make sure that you ask if you are receiving an oral cancer screening at each recare visit, and make sure that you are doing self-detection often.